Family wellness, emotional health, and mental wellness. And our goal, of course, is to make sure that families have all the tools that they need to help them be as solid as they can in their own personal, emotional, and mental wellness. Today, we are talking about depression, trauma, and anxiety, three really huge mental health topics. And we're talking about the impact that these have on marriages and families and what to do about it. If you or your significant other, or both of you maybe, struggle with health concerns like these. Maybe even you're not married yet, but you do have mental health concerns and you wonder, will marriage even be in the cards for me? And then I think what's common as well is that situations when mental illness pops up seemingly, and I say seemingly on purpose, unexpectedly, in marriages where maybe they didn't really see it before, notice it before, but suddenly it is impacting the relationship in a new way, and it can be challenging. And so what do you do about that? So joining us in the studio today is Dr. Dan Sartor. Hi, Dan.
Hi, good morning. Thank you for having me with you today.
Absolutely. So Dr. Sartor is an associate professor at Richmond Graduate University, and he's been a psychologist for numerous years. How many years?
Yeah, about 16 years, 17 years.
So you have a wealth of experience with all of these disorders, as well as work with couples and families. And so we'll be discussing answers to questions around depression, trauma, anxiety, impact on the family, on marriages, and kind of talking about what they are initially,
Yes, right.
And then some practical strategies that people can put into place immediately that may be helpful for their families. So I guess the first question I have, Dr. Sartor, is why do you think, from your space in the field, this is such an important topic for us to really talk about?
These three issues, anxiety, depression, and post-traumatic stress or trauma, the impact of trauma, are so common. They are all around us. Some of us are able to see it and identify it and get help for it. Some of us, it's just so much what we've known that we don't even recognize it within ourselves or even within our loved ones. And so increasing our awareness and our understanding about it is the first step in achieving wellness, of growing healthier and moving another step closer to happiness.
It's interesting the way that you say that. You said that people see it all around them and sometimes they don't recognize it. Right? And it's almost as though you may be saying in some ways there's a level of normalcy that people think is normal, that, oh, that's just the way they are, and, that's just their personality, when in fact there may be other factors playing in, like depression, anxiety, or trauma in their history.
That's right.
That's just not addressed.
Right. And one of the things that I often say, especially when we're talking about the impact of trauma and its negative impact on our mood and the way that we think and what happens in our bodies and the change in our nervous system, is that might be normal, but that doesn't mean that it's healthy. And so coming to grips with this notion of it might be all around us and very, very common, but most of us don't want to live common lives. We want something to be unique and special and precious, right, and valuable about the lives that we're living and the relationships that we have.
And that even strikes me as I think about the stigma that there is around mental health, especially in minority communities.
Yes.
And I would say that in mainstream culture, Euro-American culture, therapy is just more part of the norm, more part of the culture.
Right.
But with minority communities, it's much less so. And so there's a stigma around the idea of my having depression or anxiety that I can't manage, or something's wrong with me, or I'm going crazy. And so there's a pushback sometimes.
Yes.
Right, about addressing things like that. I have to be healthy. I have to be okay. I should be able to handle this all on my own. This is really not an issue. Type of thing.
Right. Yeah, and that stigma to me is just so unfortunate. And that's why I'm so grateful for shows like this and other initiatives that get us talking about it in the community, because that's the only way, I think, to reduce the stigma and to rightly understand what these things mean and where they come from. so that we can individually and collectively, by collectively I mean families and couples, but I also mean communities, right? Whether that's churches or community organizations or just neighborhoods as a whole, begin to look and think differently about these things. Not because we're looking for an excuse or not because we're looking to victimize anybody, but just simply because we want to own what is real and begin to work together for positive change. Again, across that whole spectrum, from individual to couple to family to communities, and it gets broader than that. Our world needs it, doesn't it? So
absolutely, absolutely. I love the way you say that. So if you're listening, you already know why Dr. Sartor is on the show. So if you don't know, you don't know. Dr. Sartor and I worked together at Richmond Graduate University.
Yes.
And so I learned a whole lot from him. And I laughingly, jokingly say that I'm a Dr. Sartor groupie because every time I get into a class with him or something like that, it's just an amazing experience. And so you all are in for a treat today.
Oh,
so
that's kind.
let's
Thank
just
you.
go back, and let's go back to the basics then. Let's just talk about depression.
Yes.
Let's define depression.
Sure.
And then we'll define anxiety. We'll take a look at trauma and just kind of look at how those individually can kind of impact an individual.
Yeah, that sounds
Yeah.
great.
So let's start with depression then.
Yeah, so I'm thinking now, if I have an individual that comes in to meet with me for counseling or for psychotherapy, and they're reporting depression, I'm looking for and listening for a few things. One, I'm looking for how long have they been feeling this way, and so when we're talking about depression, sometimes on the street, so to speak, we'll think about just a really quick mood swing, like I feel kind of depressed for a couple of hours or a couple of days. But when we're thinking about clinical depression, we're talking about something that's 2 weeks or longer.
Right.
And with that, there is this kind of pervasive sense in our mood that we are down or blue, we're in the dumps, or it might be the kind of thing where we just feel worthless. It can be a lot of shame. So it's interesting, there are a lot of people we talked about who don't realize what's happening within themselves, but they don't necessarily consider themselves depressed because they don't feel blue, but they're under this cloud of shame that really has the same kind of impact.
Yeah.
Yeah, and then in addition to that, then what tends to happen is the thoughts become very negative. So our thinking patterns that we keep going back to and get stuck in, so we ruminate negative thoughts about ourselves, about the world, and about the future. And then that begins to impact other things in our functioning, like our appetite either sharply decreases or increases.
Right.
We lose our appetite, or we're eating a lot to try and fill a void that nothing else is quite filling. So we'll see a change in our weight, either increase or decrease with all of that. We lose our motivation, so we can feel like we're dragging or sort of in the sludge, right? We just can't get ourselves moving. Things that used to bring us pleasure and enjoyment and delight no longer do that. So a wonderful meal just is flat, or a beautiful sunset really it's gray. It no longer is a joy for us to hold the hand of a loved one, like a child or a spouse or a romantic partner. And it just takes more for us to feel alive.
Yeah.
And then when that gets really bad, when we get stuck in that and we start to feel helpless and we start to feel hopeless about changing that, and our sense of internal confidence about being able to affect our world, when that starts to go even further into the dumps, we may begin to think about suicide or wishing it would all end. And that doesn't mean that we're planning our suicide, but it could be that.
Yeah.
It's just those passing thoughts of, boy, it'd be really great to go to bed and not wake up tomorrow because I'd be glad for this all to
It'll
be
be
over.
done, sure.
Yeah. So when I'm thinking of depression, I'm thinking of those sorts of things right
Yeah.
there.
And so I think it's good to then talk about it as well, just in terms of, while there's the list of different things that we look at when we think about depression, or we're looking for when we see people, it's also good to note that you don't have to have all of them to really be feeling the impact of depression in your life.
That's right.
You may have 4 or 5 of them, which then we can diagnosably say depression is present, but you may have 3 or 4, right? And this can show up. Typically, people, when they want to talk about someone who's depressed, they're looking at somebody who looks sad all the time, or someone who, just you don't think about the executive who's successful at work. You don't think about the student who's just going. You don't think about the mom who's just on it with her kids, always at the games. But even in those individuals who appear to be fine, there
Yes.
can be real laden depression that can be impacting them, but they mask it very well.
That's right.
Yeah.
Yeah, so many of us, what we'll do is we'll wake up in the morning and some way, somehow pull ourselves up by our bootstraps to be functional and get through the bare necessities. And we're trying to be there for, as you've mentioned, our kids or our spouses or for our employers because we've got to pay the bills. But even in all of that underneath, we're feeling very isolated.
Yeah.
We're feeling like this is all worthless. When we are disengaged from the things we have to be functional on, we tend to crash, either internally or externally, right?
Yeah.
We head straight to bed and pull the
Right.
covers over,
Right.
or it's fine to binge on Netflix every now and again, but what we do is we'll completely numb out with
Yeah.
purposelessness, right, in
Right.
front of a screen for hour after hour after hour. We can do that with social media like Facebook, and it's like we don't have an internal sense of joy
Yeah.
and well-being and purpose for ourselves or in connection with our relationships. So we end up kind of withdrawing and frittering all of this time away
Yeah.
because we're breathing, but we're not living.
And then you do that, and then sometimes folks will then get on themselves about having done that. And that
Yes.
cycle
Yes.
then just continues to go and continues to go.
Yes.
And so then if we put that within the context of, let's just say, a marriage, right? How can that look? Because some of what I've seen, and you may have seen some additional things as well, some of what I've seen is spouses will not really understand that what they're looking at in their spouse's depression. Oh, he's just tired. She's just tired. It's okay. They'll get some rest and they'll be fine. Or if there is a verbalization, well, I just don't feel right. Oh, honey, you're going to be okay. Just pull yourself up by your bootstraps. Or what's
Yes.
the matter with you? Just kind of, let's get going. There's not a recognition that there's something that's off, which
Right.
reinforces, well, what's wrong with me?
That's right.
Why can't I just get over it?
Right.
Or if we're in faith settings, I'm not praying hard enough, or I don't have enough faith, or something like that.
Yes.
Yeah.
I think that's exactly right. And all of that, which is all part of the stigma, right, is what keeps us buried under oftentimes, and what keeps us from getting the help that we need or doing the things that would be most helpful for us to get out from under that cloud. And instead, like you say, it becomes a self-feeding vicious cycle. That just adds to the depression, and the depression adds to the self-criticism,
Right.
which adds to the depression. And that's how that whole thing just gets worse and worse and worse. And yes, if we don't recognize it for ourselves and have some compassion and respect and believe that, well, maybe this comes from somewhere. Maybe I feel this for a reason,
Yeah.
and that's worthy of a little attention. Maybe that's good caring for myself. And if we don't recognize that in others, in our loved ones, we think of them as just lazy or just in a funk, or we think it's just, well, they're under a lot of stress right now and they'll get better. Well, sometimes yes, but if that circumstance doesn't change,
Yeah.
then we still need to do something. Or if it does and the person is still under the cloud, then there's something more there to investigate.
Absolutely. Absolutely. And so how can that impact a marriage?
Well, it's really interesting for you to ask that question. So a number of years back, when I was working full-time in private practice, a lot of my work was with couples. And so a lot of marital therapy going on there. And it was remarkable to me how often, yes, there were issues in their communication together. So there was real conflict there. They needed to learn some basic communication skills to help. But more often than not, that was not the whole of the story. There was another kind of thing going on in one or both of the partners that was either depression or anxiety, or the other topic later today is the post-trauma stuff. And part of that looks like just emotional disconnection.
Yes.
Sometimes it looks like the lights are on, but nobody's home.
Sure.
So it can be something as simple as the lack of eye contact or the lack of depth in conversation. How was your day? It was fine. How are you doing? I'm fine. And there's no real substance there,
Yeah.
right?
Yeah.
And sometimes that's because I'm hurt and I'm angry with you and I'm avoiding you a little bit right now emotionally. But other times it's not so much that, or that gets tangled up with,
Right.
oh, I don't feel well. I'm not happy with myself. I'm not happy with my life. I've been trying everything I know to get out of it. I've been trying harder, and I feel like I just get in it deeper. And so that does look like conflict in communication or
Sure.
avoidance in communication or just sort of this flatness where we don't enjoy things together that we used to enjoy. And we'll begin to have a sense of my partner is not himself or not herself
Yeah.
like I used to know. And
Yeah.
we start to miss and long for that
Yeah.
partner. And the other thing that I would say is then we begin to look at ourselves and say, well, is it me?
Right.
Like, do I not bring the
Right.
best out of that person
Right.
anymore? Or is it something I've said or something I've done? Like, you know, and then next thing you know, we've got another like little cycle turning inward where
That's right.
we're overly conscientious of ourselves or overly blaming our partner.
Yeah.
It tends to be one or the other.
Yeah, yeah,
Mhm.
yeah. And so two things come as, you just described that. The whole conversation of, well, it's not you, it's me, right? Just takes on a whole new level of understanding, but there's in the moment not that understanding that it's not you, it's me, right? Because
Right.
eventually, as it goes on, and we can't figure out what it is, it then turns inward. And then there is research that's shown that in marriages where one person has a mental illness, over time it can affect the mental health of the other individual as well.
Yes.
And that can negatively affect it.
Mhm.
And then we begin to see greater levels of mental health concern that show up in the other partner as well.
Yeah, I have this little word picture that I use with that, and it fits for many aspects of marriage and marital distress, or any other kind of good partnership, right, where we work closely together. And it's one thing if my spouse is in the pool and drowning and I'm not, and I'm able to sort of jump in and be of help and be of service,
Yeah.
or vice versa. When I'm in the pool and it's a little too deep for me and I'm tired and I'm going under and she is in good shape and she can jump in and attend to me and care for me, but what becomes problematic is when we're both drowning in the pool.
Yes.
And where when she's come in to help me in some sense, my flailing around or my dead
pulling her
weight
under.
now starts to pull her under.
Yeah.
And then that's when a relationship starts to feel toxic, and
Yeah.
we really in our minds we are haunted with doubts and negativity, and that's the stuff that we don't want to be left alone in.
Yeah, absolutely.
Because it's a
Yeah.
bad sign, right?
Absolutely.
That's a good picture,
Yeah.
you know.
Yeah.
Well, I've never looked at it like that, but to really be able to see two people, in the same situation, and they don't even know they're in a situation, but to see them in the pool together, both drowning,
Yeah.
that's
That's a
that's
powerful
impactful.
picture.
Yeah.
It's a powerful picture. And
Absolutely.
And it's unfortunate that it describes more couples than we
It
would
does.
like
It does.
for it to describe. And even more disheartening is that many don't recognize it. They don't see it. When we come back, what I think I'd like to talk about is something that you are alluding to. When folks don't recognize, we're talking a little bit about emotional intelligence as well,
Yes, that's right.
right? And so the basic skills that folks have not learned, minus trauma, minus, anxiety being an issue,
Yeah.
just the basic emotional intelligence skills that would help people kind of be able to see something is going on here, right? And it's not attributed, you know what I
Right.
mean?
Yes,
So
yes,
we'll
yes.
talk about that when we come back. We're going to take a quick break. See you in a minute.
Do you want peace in your family relationships instead of conflict? Do you want a safe, loving marriage instead of one that is failing? Are you troubled about what's happening with your children and need help for them? At Legacy Changers Counseling Centers, the goal is to strengthen individuals and families with cutting-edge emotional and mental health interventions. The exceptionally trained counselors at Legacy provide the specialized guidance you need in a safe environment of belonging so that you can make the life changes you and your loved ones need. Get real help for your emotional and relationship needs. Call today at 404-334-7575 That's 404-334-7575. You can also find us on the web at legacychangerscounseling.com. Call now and transform your life today. 404-334-7575 or legacychangerscounseling.com.
I was just about to say, I was listening to the two of you go back and forth, and I began thinking about marriages. And when you have a partner that does not understand fully what the other one is going through, and sometimes I see where I don't understand what they're going through, so I'm going to leave the situation because this is too overwhelming for me. How do we connect to the partner that is the stronger one but is leaving because they can't understand? Like, I see that's where a lot of disconnect comes within marriages. One stepping out and the other one still sinking beneath the sand in the marriage.
You know, and tell me your thoughts on this, but as you say it, and you reference the one leaving as the stronger one, I almost want to say
They're not. Yeah.
that's not, because they're leaving because there's an emotional void that's not being met. They don't know how to meet it in a healthy way.
Right.
The spouse is not meeting it, and there's not an ability to think through and talk through and work through and understand self.
Yeah.
That emotional intelligence, what's happening for me while all this is happening for my spouse, what's going on in me, and how do I meet that need in a healthy way? And then how do I listen to my spouse? How do I connect with the emotions that are there and understand that in a different way as well?
Yeah.
Yes, yeah, I really resonate with what you're saying, Sonja. In part, because some of this comes back to, and this isn't, I know, our topic for today, but what we believe marriage is about and what we expect it to do for us and what we expect to be able to do for others. So to be sure in a marriage, how each partner is and how they function and how they're doing so powerfully impacts the other. And that's a good and a beautiful thing, and that's part of two people becoming one. But there's also some aspects of my own well-being. There are aspects of my own mental health that while my wife's name is Robin, so while Robin's actions and behaviors and her well-being powerfully impacts mine, mine can't be all up to her.
That's right.
And vice versa.
That's right.
And so I think that's what you're alluding to, that when there's someone who says, ooh, I've got to get out of this, maybe they themselves are not attending to their own well-being sufficiently. And that's not for the purpose of having to rescue the other one, but be able to be in it with them in a way that begins to encourage and facilitate their, number one, their awareness of what's going on, if they're not aware, and number two, facing it in a healthy and constructive way. And then hopefully number three would be that they would do that in some way together. So that they're stronger together rather than, you've got this going on, you go take care of that and I'm going to wait right here for you. Right? Now that is one way to do it, but it's, to me, it's not the best.
And that's typically what happens. That is unfortunately typically what happens.
Yes.
The problem is with my spouse, they need to get that fixed. And then when they get that fixed, we should be okay.
Right.
Yeah.
Yes. Yes.
And so that just really does speak to the idea that health, emotional health, and emotional awareness, so not just emotional health awareness of that person and the impact that they're having, but your own personal self-awareness and your ability to regulate emotion so that you're able to connect, understand, perceive in a way that's not clouded by raw emotion, because emotion is the thing that hits first. When something happens, our first reaction, just instinctively, and we're wired this way, is going to be an emotional reaction. If we haven't really developed skills to deal with that and mediate that and use reason to mediate our emotional responses, then these situations in our relationships where there is depression, where there's anxiety, where there's trauma, it's just that much harder to try to work through and figure out.
Yes.
Yeah.
Yeah, and to me, some of the basic, you were referring to emotional intelligence or even social intelligence, that involves our being aware of what we're feeling. Some of us are more attuned to that than others, right? So there are some of us where the volume on that is turned way down, and we're acting out our emotions without quite being aware of it, but the people around us are aware of it. And then there are others of us that are the other extreme, and it's turned up quite loud. So I'm very aware of my anxiety in a moment, or my anger in a moment, or my fear, or maybe my sadness, and it's so loud that it overcomes.
overwhelming me.
Yes, 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 yes. And then what we want is maybe to try and be someplace in the middle, where we can be aware of what it is that we're feeling. So there's an openness to it. And value it, like it's meaningful, but not necessarily let it drive our behavior.
That's
so
right.
just because I'm angry, that doesn't give me the right to lash out in my anger. But I do want to consider, well, what is this anger about?
What's
Where
that
does it
anger
come
about?
from?
That's
So I can
right.
choose appropriately. And this is where you're talking about the reason part, or rationally choose, well, what do I want to do with this
Yeah.
that will be ultimately good for me and good for the people I love?
And then the ability to do that is sometimes based in an understanding that anger as a secondary emotion is most often driven by some other emotion
Yes.
that we haven't really accessed yet.
Mhm.
So that emotion could be jealousy, disappointment, disillusionment, any number of things that we haven't quite gotten to. It can be based in those that self-talk you were talking about before. My spouse is going, this is what's happening with my spouse. Is it me? Is this tapping into my own insecurities about something else?
Yes.
Right? And so my insecurities that I'm not really thinking about or aware of are coming out in anger, but getting underneath that is what emotional intelligence allows us to do, in the
Yes.
space to do that. Yeah.
Yeah, and it takes kind of the courage to be open to what we're feeling,
Yeah.
and the courage to lean into that, so to speak, to engage that in some self-reflection.
Yeah.
And for some of us, a lot of us, we need not only to self-reflect, but we need a conversation with somebody about it. That feels vulnerable. That's why people see counselors and therapists, because it feels safer and secure to figure out, okay, what are these emotions? And because sometimes it's hard just to put labels on them, right?
Sure.
Just to give a word that, no, this
Sure.
is sadness, or this is deep disappointment, or this is anger, and this is rage, or this is fear. So to have words for them, to own those words, and then begin to think about, okay, what does this mean? Where does it come from?
Yeah.
And what do I do with it moving forward? Because we don't want to keep doing the same thing.
Yeah. Yeah. I mean, I hope that folks listening get the understanding of how complex this can be. And that whole idea of I should be able to do it myself,
Yeah,
right? Without help,
yeah,
right? Is I don't want to say it's too high of an expectation. That's not what I'm thinking. It's just more an owning or allowing for our humanness. We are very
Yes.
relational
Yes.
people,
yes,
right?
yes.
And so healing often comes in relationship with someone else. And I don't mean necessarily intimate marital relationship, but
Right.
just in general relation to
That's
other
right.
people,
Yes.
right? And so that's why the counseling relationships can be so helpful and
Yes.
so healing, because it's a safe relational experience that allows you to be vulnerable, as you said.
Yeah, and what works in counseling works because it's true of any relationship. It's just in counseling, you've got certain parameters, and a person who's trained to do this in a particular way and focus in on the right thing so that it facilitates or catalyzes that healing process. But
Yeah.
why it works in counseling is because it's what's true and good in relationships in general. And I was thinking as you were speaking just a moment ago, is the way that I see this is that as human beings, we are nuanced and we're complex and we have multiple levels, and that's a beautiful thing. It's a
Absolutely.
wonderful thing. It can be a little overwhelming sometimes, but if we have eyes to see it, it becomes what's wonderful about ourselves and what's wonderful about the people around us that we never fully know and get and understand that other person. There will always be more to explore and to see and to experience in them and with them. And that's true of ourselves also. And sometimes I think we shortchange ourselves by thinking it should be simpler and easier than it is. And while that can be overwhelming, it doesn't have to be.
Yeah.
The other thing, if I can go a little bit further, as you were talking about the role of relationships in our own healing. You know, if you think about it, we all learn language growing up from our families and in our environment, our social environment around us.
Yeah.
And depending on the family environment we come from, some may be very good at helping young children identify what they're feeling. And we put the look on our face. If they're feeling sad, we put out our lower lip and we pout and we say, "You're feeling sad," right?
Oh,
And
poor
that's
baby.
exactly. And that is so important though, because that child,
Yeah.
that's the way that I learned what sadness is.
Yeah.
That's how I learned what anger is. That's how I learned what joy is. And I didn't do it on my own. Someone mirrored that for me. Somebody put a word to it. And then after that happened a few times, that began to go into my own mind that, oh, I'm feeling sad. Oh, I'm feeling really happy right now. I'm feeling very angry. I'm feeling fill in the blank, right? Whatever it is. And then the other thing that ideally happens, and of course, not all families are ideals. Our ideal is that whoever that caregiver is that does that with us, they hold us, they kiss the boo-boo, they
rejoice
do
with us.
something. That's
Yeah.
right. And we learn then how to deal with the emotion
Yeah.
by what is shown us and taught us by somebody else. So that if we haven't had that, that doesn't just all of a sudden come
Appear.
on board and
Sure.
appear.
Sure.
We go through adolescence and we're flooded with emotion, and we're going through so much of that alone and in isolation or with peers. And
Yeah.
of course, our peers
may
are
or may
great, but
not
they
be.
don't necessarily know.
Right.
Yeah.
And then we get to adulthood and we get in marriage, and next thing we know, we don't realize what it is we're feeling. We don't have words for that. We haven't learned how to communicate that to somebody else. And we haven't learned how to have a relationship, a point of connection that helps us cope with it in a healthy way. So what do? We isolate, we become depressed, we're anxious because we feel all alone in it. Then we turn to things like drugs and
Yeah.
alcohol or other behavioral vices that become our addictions
Yes.
because we're trying to regulate what we feel by these other things that end up being more destructive
Yes.
rather than helpful.
Yes.
And in the end, the way that we're wired and that we're created, whether we look at it from a psychological perspective, this whole thing called attachment theory, or for many world faiths, if we see their emphasis on love, whether that's Christianity or Islam or other religions, Judaism, that with these two things they say that what we're wired for and created for is a kind of intimacy or bondedness in our relationships.
Yeah.
We miss that, and we miss out on joy.
Yeah, yeah. And so people can, as you laid that out so beautifully, people can see the trajectory. There's an understanding now. What I see in adulthood is not just in adulthood.
That's right.
What I see is the result of years of experiences culminating to be this person that's in front of me that I'm married to, or is my mom, or is my dad, or whatever it is,
Yes.
right? And so that gives context to say, that's just the way they are, is not really, that's just the way they are. There's more,
Right.
and that speaks to the nuances. What's possible for them is tremendous with the right intervention, with the right recognition of what's really transpired and what's really in front of me, and then what potentially can help.
That's right.
Yeah,
And what's
yeah.
beautiful in terms of the potential of a marriage
Yeah.
or a friendship or a partnership is that there's the possibility of together co-creating
Yes, something
new
different.
patterns, new ways,
Yes.
new experiences,
Yes.
new identity,
Yes.
which is what captivates us in that romantic phase, for example, of a romantic relationship to begin with, because we feel that, we sense that, it's palpable, and that doesn't naturally stay, right?
Right.
The romantic phase runs its course to
Right.
other stages of love. So just because we've fallen out of romance doesn't mean that we no longer have love.
Right.
If we understand it and have eyes to see it. But there are ways that we can continue then on the promise of that romantic period. Maybe it doesn't all feel the same way, but moving beyond that phase of ways of communicating and seeing and understanding and leaning forward into life together in a way that creates a new normal,
Yeah.
that changes our identity,
Yeah.
that creates new possibilities individually and collectively
Yeah. Yeah.
in that relationship.
Yeah. And I think, the thing to think about there too is without the awareness of the need and the possibility for creating a new normal, what ends up happening is those same things that we learned in childhood, we end up teaching our children.
That's right.
And then we have generational cycles of dysfunction around those types of things because there's not an awareness that comes that there can be something different.
Yes.
Right? And there's a way to actually move forward in a different way. And so that becomes really important because the mental health of parents impacts their children
Oh.
in huge ways.
Mm-hmm.
In huge ways. Yeah.
Yeah.
I share with young people, it's nice to do what mom and dad did, but if it didn't work, if you felt internally this is not working, then you don't have to jump on that board. You know, you can make your own path. That's the beauty of being the individual and having two different people come together, because you are speaking two different languages. Just because you grew up in a home that was one way, your marriage and your life doesn't have to be that way. Pick out the great things that you saw worked, and then the other things, figure out how you want to make it work, you know. And I feel like that's where the partnership comes in between the two, and that's where they can be there for each other mentally and emotionally, you know, rather than figuring out what worked for their parents or didn't work, you know. Yeah.
Makes me wish that there was just more of an emphasis on, in premarital counseling, on understanding emotional health
Yes.
Yes.
and the impact, you know, and where are you in your emotional health. A lot of times premarital counseling is a perfunctory just overview of, well, this could go wrong, and then here's how you might fix it, or that could go wrong, and here's how you might, but it would be so much more valuable for it to be more than a 5-week or 6-week overview, and just a mutual delving. Who are we? How do we understand each other?
Yes.
Right? Who am I?
Yes.
Who am I? And who are you?
Yes. Yes.
That's not who I thought
Yeah.
you were.
Yeah. Well, you know, I was giving that word picture of a couple in a pool.
Yeah.
And,
You got another one?
Well, no, it's the same one, just
Okay.
taking it one further step. And
Okay.
that's, you know, we were talking about it in terms of other things being the reason why one partner or the other is sort of drowning in the pool. But it's a significant turning point in that relationship, in a marriage in particular, when each partner is drowning and looking at the other and saying, "I'm drowning because of you."
Because of you.
And you are not the person that I thought that you were, or you did something that I never dreamed you would do.
Yeah.
And when it feels like it's not just that we're both drowning together, but I'm drowning because of you, is when it gets really rough.
Sure.
And we make a lot of waves and a lot of
Sure.
splashing
Yeah.
in those situations. And the fact of the matter is because we're all different, and this is going back to what you were talking about, Sonja, just a few moments ago, about how our past comes to play out in our present, is that we all have our traumas. Some of them are capital T traumas, some of them are lowercase t
sure,
traumas,
sure.
but they significantly impact how we see ourselves and how we experience others. And those become things that we significantly avoid, or that we unknowingly act out over and over and over again. We recapitulate is the
Yeah.
fancy word for it. And when we do that, and when my stuff gets crosswise with my spouse's stuff, with Robin's stuff, when the very thing I'm most wanting to avoid because that means shame for me, or that means failure for me, or that means for me a fear that I'm going to be abandoned or not good enough. And so my response and way of coping with that triggers that very same thing in Robin and my
Yeah,
spouse.
yeah.
And then we are sort of triggering each other. If we don't realize that what we're doing is my behavior, say, for example, if I start to feel like a failure and I start to tune out and I start to numb out on social media or on Netflix, or I start to drink alcohol a little more, I do whatever. So for me, I'm just coping, right? And then if that for her triggers something from her past,
Right.
that's an abandonment, and it means that she's not worthy and that she's going to be alone. And then she reaches out and, you know, expresses some anger or some frustration towards me, and that's triggering my stuff again. And so I do more of the same. You can see the vicious cycle that
sure,
ensues.
Sure.
And it's not just stopping the cycle, but being able to understand, okay, this for me is coming from somewhere, and it
someplace.
means something to me.
Yes.
And it's coming from someplace in her and means something to her, and it's probably on the surface not meaning the same thing.
Right.
And so we're wounding each other. And all of a sudden we think we're not compatible, and we think the relationship is toxic, when in reality what we need most is the relationship, and for a mutual understanding.
Yes, that
And to
can
sort of
bring
letting
healing,
down
yeah.
the guard just enough.
Yeah.
And a sort of seeing and having compassion and empathy for each other just enough, and that's where the healing comes
Yeah.
in.
Yeah.
So the very thing that feels most destructive to us is actually also if we're strong enough and can see it, the pathway to our healing
That's right.
and a breakthrough.
Yeah.
Because if I just leave Robin and go to somebody else, you know what's going to happen.
Yes.
I'm going to reenact that all
Reenact
over
the
again
same thing.
and have to do the same thing all over
Yeah.
again. Same thing for her.
Yeah.
Um,
Yeah.
yeah, I mean, I want to emphasize that if she leaves me, she's not going to find a better. But the fact of the matter is she might find a guy who's like better on all sorts of areas, but they'll still get crosswise
Yes.
with each
With-
other, where our
yes.
deepest stuff
Yes.
gets crosswise
Yeah.
with somebody else,
Yeah.
and you still got to do the work.
Yeah.
So after over 25 years of marriage, I don't want to start all over again. Let's. We've got too much
Figure this
invested.
out.
Let's work it out, right? Let's figure it out.
Yeah. Yeah. And for many couples, that just feels too hard.
Yeah.
After 25 years, well, and some don't get that far.
Yes.
After 10
Oh, I
years,
know.
after
Yeah.
15 years, it's
Right.
just too hard, right? And they've done that, come to those decisions without intervention, without help from someone outside being able to say, someone qualified outside who can be helpful and create a safe space for them to begin to look at what's my mud puddle, right? What is my mud puddle? And not only what is mine and how do I understand mine, what's my spouse's mud puddle?
Yes.
Separate from me.
Mhm.
What's my spouse's?
Mhm.
So that I can understand and see that person's pain separate from me. It's their pain.
Yes.
And I think part of what folks never get to is really understanding what is the pain of the other person. It's not doesn't have anything to do with me. I have my own pain. But what's the pain of the other person? And then seeing their lens, seeing their behavior and their verbalizations through the lens of that's coming from their pain.
Mhm.
That comes from someplace else.
Right.
And that's what I'm seeing. And what I have found in couples who've been able to get to the point where they see the other person's pain and understand where it's coming from and how it impacts what comes their way, there is such a level of empathy
Mhm.
and such a level of understanding that arises. Oh, now I get it. If I had experienced what you experienced, or if I felt that, I can see why you might do this or do that. And it's coming my way. But now I can understand it's not me. It just happens that I'm the one that's closest in relationship to you.
Yes.
And so I'm getting that thing that says I'm in pain and I don't know how to deal with it. I don't know what to do about my pain.
Mhm.
And that's kind of where things just don't come together.
Yes.
Yeah, yeah.
Yeah, I think so. It can be so helpful to have that shift of perspective like you're describing so that we have insight and awareness of where the person that we love is coming from.
Yeah.
The second thing that I would want to add along with that then is sometimes what comes along is this compulsion to fix them.
Oh my gosh, yes.
And that's where oftentimes
Yes.
we do just as much or more damage,
Damage,
as
yeah.
not seeing where their pain is and where it's coming from. And this is hard, so I don't want to pretend that this is easy. And these are the parts of relationships that can be kind of mucky and
Yeah.
muddy or murky. And the fact of the matter is I can't fix my spouse or my loved one. I can't. I have a lot of I have adolescent kids, and I have a lot of influence still in their world, but there are parts of them now I can't fix. And when I go to fix, they push me right away.
You get that too.
I do.
Oh my gosh.
yeah.
I'm not alone.
And doesn't that feel good to not be alone?
Yes.
But there is this powerlessness and this helplessness,
Yeah.
which doesn't mean that we don't engage it. It's how we engage it.
How.
And the pressure is not if you would just read this book or if you would just go to this person or
Yeah.
if you would just do these things, it would be better. But it's being able to begin to communicate from this sort of centered place of, I see that there's a lot of pain in you.
Yeah.
And I think these hurtful behaviors and destructive behaviors are because of some pain. And they hurt me, and I want for us to be able to talk about it.
Yeah.
I want for you to be able to do things, and I want to help you in whatever way that I can, but I know at the end of the day, there are things that only you can do to heal and to grow with this, and to keep
in the
walking
meantime,
that line.
I'll sit with you.
Yes, that's right. That's right.
I can't do it for you. I
Right.
Yeah.
can't, but I can sit with you
Yeah,
in your pain and help you hold it a little bit
that's right.
so that you're not alone. That relational piece
Yes.
again.
Yeah.
You don't have to be alone in your pain.
Right.
And likewise, you can sit with me as much as you can. And So as I say, as much as you can, that's also important to note, because our spouses can't necessarily be the ones that hold all
Right.
of our pain,
That's right.
right? There may be limitations, hence the need for supportive others, counselors who can also be part of that healing process along with your spouse.
Yeah.
Yes.
Yeah.
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 And it's a lot easier to say it than do it. I think we can
Yeah.
acknowledge this.
Yeah.
But maybe we can also say that we've experienced that just enough to know that it's possible, to know that it works, not in the sense of you plug in the equation and it works out, but there's a truth in the principle that if we live well enough in accordance to that, it tends to end well, or we cope better with
Yeah,
it.
yeah.
And then the one other sort of hard piece, I don't want to paint it too pretty of a picture, is that when that spouse is completely closed to that, and they're making decisions that are self-destructive and whatever else,
Yeah.
part of not fixing that is, while we're protecting as best we can ourselves and maybe kids or whatever else from the natural and necessary consequences, we don't rescue that spouse from those consequences, and we let them be what they are
Right.
as a kind of wake-up call. So this isn't a kind of codependency that we're talking
That's
about.
right.
So we're not bailing out, we're not being codependent of trying to fix something we can't, but we are staying centered in what we're feeling and the pain of it, and what they're experiencing and the pain of that,
Yeah.
and addressing that persistently yet caringly, right? It's this compassion and empathy, but firmly.
Yeah.
And that's a real possibility. And for me, when I'm in situations like that, I need support. I need people who know where I'm at and what I'm experiencing. I need to be able to verbally unload with them.
Yes.
I need their encouragement. There are certain things I need to be reading, or certain things I need to be doing to take care of myself, because it's hard work to be there.
Yeah.
But we can also, can I say this? We can thrive in that situation,
Yeah.
even when we're in a relationship that feels very broken.
Yeah, I think that'll be a good segue. We'll take a break, and when we come back, we'll talk about then the big T trauma, because
Yeah.
the situation you're describing is very typical when one spouse has a big T trauma,
Yes.
right? So
That's
we'll
right.
come back and talk about that. We'll be right back. Dr. Sartor, I forgot in an earlier segment, just give everybody just a rundown of just your, I don't want to say credentials, but I'm going to say credentials.
Okay.
Just, your history, what you've done in the field, the type of work you've done overall, in addition to work with couples, what's your specialties, things like that.
Yeah, okay. Let's see, a thumbnail sketch of that. Well, I got into the field of mental health by way of pastoral work and pastoral ministry. It was pastoral care. So I was attending seminary and working in a pastoral role, and decided to pursue counseling because I wanted to understand what it was like to work with people more closely, more intimately in their process of healing and recovery. And so I earned a master's of counseling at Reformed Theological Seminary, and loved what I was learning, wanted to learn more, and also wanted a credential to teach. So I went on for another master's and a PhD in clinical psychology at Rosemead School of Psychology out in Los Angeles. And since that time, I've worked in a number of different settings, whether that's been college counseling centers. I've directed some college counseling centers. I've worked full-time in private practice. I've worked part-time in private practice and taught full-time. That's what I'm doing now. And have worked in medical centers or community mental health centers as well, and have really loved, one of the wonderful things about this work is you can work in all sorts of different contexts. And work with a broad variety or array of people and issues, and I love that too. And one thing that I want to be sure to say from where we were talking before the break is that after these years of working with people and entering into these conversations, what's really amazing to me is I've never walked away and said, well, that didn't make a lick of sense. I've never walked away and said, this person's just utterly crazy. Instead, it's always been, well, of course, that makes all
Makes
kinds of
sense.
sense when you
Sure.
get to know the story and you get to know the
Yes.
person.
Yes.
So I have loved that about my work. I've worked a lot with couples, as you've mentioned, in marital therapy. Work a lot with individuals in trauma recovery, and of course depression and anxiety. Those are sort of like things that come very often to our offices, those of us that are counselors and therapists. And so more recently, I've also been doing some teaching and training in the area of complex trauma and complex trauma recovery into organizations that work with survivors of human trafficking about trauma-informed care and about guarding themselves so that they don't burn out, and managing things like burnout in the field. And that's all been really, really wonderful and really enjoyable.
That's awesome.
Yeah.
That's awesome.
Yeah.
So that gives us a good segue into talking about what we said was big T trauma. So
Yes.
let's define for folks little T, big T
Mhm.
trauma. Just the idea that in all of our experiences, there are traumatic experiences
Yes.
somewhere in there. And so we all experience in some way, shape, or form some type of trauma, but some more than others.
Yes.
Yeah.
Yeah, and we're all different in terms of our level of resilience to
Yes.
that, and some of that comes from our genetic constitution. It's hard to admit, but the fact of the matter is the playing field is not level there, right? Just like in other conditions like breast cancer or for diabetes or other things, some of us are more predisposed than others, right? So there's this genetic sort of foundational degree of resilience, but then above and beyond that, it's what we experience in our early on families and caregiving environments that help instill in us ways of coping and understanding. We talked about that a little bit earlier. Some of those things that help us develop a good social intelligence and emotional intelligence, and that help us be more resilient to traumas. And then, of course, there are all sorts of things about where we live. Some neighborhoods, and because of how segregated we are, some ethnic communities are more vulnerable to the violence that's happening around them, and sort of the problems and the trauma of poverty, right, or neglect. Those things we don't always think of as traumatic, but they are. And they affect individuals and families and communities and classes of individuals. And then when we think about trauma, we're usually thinking about things like if somebody has a sexual assault or some other form of child abuse, or maybe a soldier who goes overseas, right, and is on the battlefield and is exposed to death and violence firsthand, or these. We might think about our first responders that come onto the scenes of accidents, and there's carnage, and these things sort of affect us. They sear something on our brain, so to speak. And so there are all of these levels of trauma. And what I would say is, when we think of capital T trauma, we're thinking of like clinical trauma here. These are incidents where an individual is their life and their well-being, like their physical well-being, is threatened or lost, or that's lost for somebody that they've seen or somebody that they're very close to. So these are near-death experiences. It can be a significant car accident or other sort of accident, or some kind of violent crime, or even we see it in the aftermath of a natural disaster, and so those can be capital T traumatic experiences. The lower T traumatic experiences, I think of, are those that may not reach like that diagnostic criteria for clinical trauma, but still has all of the dynamics within us, which we'll talk about in a moment, I'm sure. And usually what causes that is when we feel two things together at once. One is a very strong sense of fear. So that can be terror, that can be dread. It could just this very overwhelming sense of fear, and what gets coupled with that is the feeling of helplessness or powerlessness to escape. So if there's something fearful that happens and I can escape, I maintain within me some sense of I control what's happening. Or if the fear just isn't quite that high, even if I can't escape, well, it's okay. My coping and my sense of self isn't flooded and overwhelmed. I'm sort of resilient enough to manage it. But if those two things happen together, and of course this happens easily for children, right? And it actually happens easier, maybe not more than children, but than adults for adolescents, because they're still fragile even though they walk with a swagger and think that nothing can get them. And that can create these patterns of trauma dynamics that we perpetually avoid. And so it has a lot of power by what we're avoiding, or we relive it and recapitulate it, which gives it a lot of power. And then that, of course, as we've been talking about up to this point, powerfully impacts our relationships and negatively impacts our loved ones as well as our own well-being.
Absolutely, absolutely. And so, talk about as well childhood trauma, where molestation is the case, or addiction in parents is the case, or physical abuse is the case, and how those formative years, trauma in those formative years as well, can show up in adulthood in relationships.
Yeah, so I want to begin with saying that what you're describing is both very biological, it's very neurological, what's happening in the development
That's
of the
right.
brain when children are young.
That's right.
So certain pathways get laid. There, you can think of them as laying train tracks down.
Yes, yes.
And where those train tracks are laid, we're going to keep running the train over and over and over on that. And even when we've laid that train track, think of this passageway of all of these neurons linking up together and firing together and becoming accustomed to working together. When we have those laid in very positive ways, when we experience trauma, it's like we put in a switch track. And instead of going down that positive route, we end up going a more detrimental route, which involves shame and fear and anxiety and helplessness and lots of what we call nervous system hyperarousal, which is this anxiety response in us, where we feel anxious, our hearts start to race, our palms get sweaty, our stomach has butterflies, or we'll get nauseous, our pupils dilate, our thoughts start to race, right? All these things that we think of as feeling anxious. Well, that's all very biological, and it starts with what's happening in our brains.
Right.
And so during these developmental periods, we're either laying down good train lines to good destinations, or we're laying down train lines to bad destinations based on what the neglect is, the chronic stress is, or things like abuse, whether that's molestation or just overreaction and anger that's physically hurtful to a child, and so forth. And what I was saying is that even when we first lay down good train tracks or good train lines, the trauma and neglect can end up changing the route on that, right? And so where we end up going whenever that train starts, right, any triggering event is a bad place rather than a good place. And that's where we get our depression and our anxiety and these other things like post-traumatic stress.
Right. And so when we think then about placing that in the context of marital relationships and families, and we talk about that example that you presented before the last break, where you have a spouse who's toxic and another spouse who has to try to maintain and take care. That toxic individual, we're talking now about the adult version of that child, right?
That's right.
And so the questions always come, why is it so difficult for some people to make changes in what's happening for them, right? Why does addiction just continue? Why does the anger and violence just continue? And so you explained it very well. And so those train lines have been laid. And so the interventions, it's almost like rooting up the train lines that's there, the bad ones, and laying new ones, right? That process is tremendously difficult. If you just think about it in the street, it's tremendously difficult. It's like taking a jackhammer and trying to get all that up and then smoothing that road so that another line can be laid.
That's right.
That's why it's so difficult.
Yeah, and sometimes, if we're honest, it's harder to come back and do it the second time, right? Than getting it laid right the first time. But the reality is that for most of us, where some of our train lines are, I'm not trying to make us all victims, just recognizing that we all come from broken backgrounds, that whether it's harder or not, that's the work that we've got to do is when we begin to recognize that, this thing that happened to me, or this way that we sort of handled these issues or didn't handle these other ones, means for me, I've got to become aware of where my train lines take me, and I've got to do some work, even if it's a little harder to do it now than what it would have been when I was younger, to have a different destination on my train line. And then when we're raising our own children or working with nieces and nephews or playing, with other kids, we can be mindful of that and not bring forward the same broken patterns and destructive patterns from our past. But that's hard. If I can use one other word picture, I feel like it's trying to get into orbit. And at first it takes a lot of fuel and a lot of jet thrust to get outside of the gravity of what we've typically done. It's like there's a rut that's been built there, and it pulls us back to that.
Yes.
And we can eventually break out of that gravity and get into orbit, and it's wonderful. But it does take a
It
fair amount of
takes
work
a
early
fair
on,
amount
and
of
it
work.
takes
And it takes help.
purposefulness.
And it takes help.
Yeah.
Yeah.
Yeah, yeah, and that's how trauma can help us understand addiction.
That's right.
And can help us understand the relational challenges that we've been talking about.
That's exactly right.
Yeah, yeah. And so, help us understand the impact of trauma on compassion, having a greater sense of compassion or hope.
Yeah, I think first we have to understand what are the signs and the manifestations of trauma in our lives? What does that look like? And then we can see how that impacts our capacity for compassion and empathy for ourselves and for others. So one of the things that trauma tends to do is it tends to keep intervening and interrupting in us. That might come in dreams, like nightmares, or that might come in intrusive images or memories where we're going about minding our own business. We're not wanting to remember this. And then something happens that causes us to remember.
Yeah.
And it might be something that somebody says, or a scene on television or in a movie, or I know a person
Smell.
who, yes, any sense, right?
Yeah.
I have somebody who I know who was beat up a lot by an older sibling, and just that older sibling's name in a workmate, right,
Yeah.
triggers something.
Yeah.
And so but things that we see, things that we smell, things that we taste, physical sensations, right?
Yeah.
So for individuals who had sexual abuse while they were growing up, the sexual relationship, even with a loving partner, becomes very difficult at times because the intimacy of touch triggers
Yes.
the other parts of their post-traumatic stress response. So it's the intrusive images or intrusive re-experiencing on
Yeah.
so many different levels.
Yeah.
The second is, with that often comes this nervous system hyperarousal or anxiety, which I described a few minutes ago. It's the racing heart, it's the rapid and shallow breathing, it's the racing thoughts, it's the sweaty palms and muscle tension, and it's the butterflies in our stomach or feeling nausea, because all of these things, we've gone into the fight, flight, or freeze mode. So
Right.
there's this anxiety that comes. And when that comes, we're edgy, we're tense, we have a heightened startle response. So little noises cause us to jump. And with that, when all of that's going on in our minds, we don't concentrate as well. We don't focus as well. And when we don't, we become forgetful, or we don't store things in memory. So it can even look like that, right? So we have those intrusive re-experiences. It causes all of this nervous system arousal. Next, then what tends to happen is we then avoid, either knowingly or unknowingly, anything that triggers that stuff. So I know of somebody who had, unfortunately, a sexual assault experience in a hotel when she was a young adult and late adolescent. And then many, many years later, she was traveling, and we were talking, and she had no idea why she hated to go to hotels and why she was so nervous. Well, for me, it was crystal clear. It was plain of day. Well, of course, there are all of these things, sights, sounds, smells, that would trigger these things. But she wasn't drawing the connection. It's easy for us not to draw
Yeah.
the connection.
Yeah.
So there are avoidance in us. She wanted not to travel. She wanted not to go to the hotel. She wanted all of those things. And it could be avoiding places, people, cars, any sorts of things that would trigger us. And we might, again, be aware of it, or we might not. And then the last thing is, what happens in us is then this begins to negatively impact our mood after a while, without being able to feel like we can control what's happening in our minds and in our bodies.
Yeah.
We start to feel depressed. And we lose our significant sustaining beliefs about ourselves. So our self-esteem plummets, about the world. The world is no longer safe, about other people, can't trust other people. And even then our faith, right? But like, God abandoned me. If God exists, he's not good, or he's not good to me. And all of those things then start to implode. And when all of those things are happening, then of course it's very hard for us to have empathy for ourselves or compassion, or empathy and compassion for somebody else, because basically we're drowning.
Mm-hmm.
So we have all of these things that we're trying to manage and cope with.
Yeah.
Again, sometimes knowingly and sometimes not, because that's our baseline. This is all we know. We don't even realize that we're barely able to keep our head above water.
Yeah.
But when we have all of that going on, where is there room for me to stop and have empathy and compassion and care for you?
Yeah.
Or empathy and compassion and care for me?
That's right.
There's only so much in our human container that we can hold, and it's full of trauma or full of depression or full of anxiety. And then there's not space for us to care.
Right, right, right. And that's why it's so important, hearkening back to one of the previous examples, for that spouse of this individual to understand that there's no fixing that you're doing.
Yes.
You are self-caring and caring for children if they're there, and creating a safe space for you and that child while this person tries to get help, hopefully, right? And there are two things, though, even as we look at then, how do we do this? How do we move forward? How do we get help? What does that look like? It can look like any number of things. A lot of times it will look like individual work for that person, as well as supportive work for you. But in some cases, a lot more of us are doing couples work, where we're able to work through some of that trauma with that individual, with the spouse as well, to help provide a supportive framework for how this could look, increase understanding, and then provide a supportive framework. Can you talk a little bit about that? When is it helpful and when is it not?
When you say when is it helpful, when is which helpful?
Doing it in couples work
Oh,
as
okay.
opposed to individual.
Oh yeah, that's a really good question. And really, I usually don't know until till I'm in the dialogue with a person or with a couple.
Yeah.
There are some individuals that, because they don't see it, this would be the kind of person that we talked about before, where their sensitivity and awareness is turned down. Think of this dial like on the chest, right?
Yeah.
And it's turned down. And their spouse sees it and feels it, and the spouse somewhere along the line says, look, we've got to do something, right? In some cases, it goes to the point of, if we don't get counseling, this is over, right? That's just how it plays out. And they come, and in those cases, they'll be willing to do something because they want to preserve the marriage, even though they don't see it and don't get it.
Yeah.
And so in the context of the relationship, I'm often doing the work through the relational angle.
Yeah.
And then at some point, oftentimes, they'll see it and they'll get it. And if we need to do more individual work, we can shift what we're doing, or I can refer them to somebody who will do that for them. And in other cases, oftentimes it's just the other way. When I was talking about the person where that volume
It's turned
button was
all the way
turned
up.
way up,
Yeah.
a lot of times they need to work individually first,
Individually.
because the relationship constantly triggers them.
Yeah.
And so until they're sort of stabilized and settled and develop some sort of regulation and some centeredness,
Yeah.
and dealing on what keeps triggering them, then they can come back and enter into the relational context, the
Yeah.
marital or couples therapy, and begin to work on how that's playing out in the relationship. And then, if there's an individual who says, I see this as a problem in my marriage and in my spouse or my partner, and they are not willing, there is this persistent process of constantly inviting, encouraging, letting some of those natural or logical consequences play out, and then sometimes saying, look, I've gone as far as I can.
Sure.
I'm just so depleted. This isn't good for you. This isn't good for us. I don't want for this relationship to end. But if you or we don't get help, this is as far as it will go.
Yeah.
And that's just the reality of where things can come to.
Sure.
But I would want to see everything else happen first before we get to there, because
Yeah.
it creates its own chaos.
Absolutely.
The loss of the relationship, the threatened abandonment
Yeah.
is what that feels like
Yeah.
underneath.
It's
Sometimes
not a solution.
That's right.
It's just another set of problems
That's
to
right.
work through.
That's right. But sometimes that's what's needed to bring the leverage, to bring the change. It's just we don't want to keep coming back to that over and over and over again, because that becomes manipulative. That
Sure.
becomes unstable for everybody. When we play that card, we need to play it only once.
Yeah.
That's not a card we can keep playing.
Sure,
Right.
sure. Anything?
No, this is good. Like, it's just, it's great to be able to sit back and listen, and get insight to help others, who are going through. So I've actually just been sitting here gleaning from everything.
So you see now why at the beginning of the show I said, sometimes I'm a Dr. Sartor groupie.
Yes,
See?
absolutely.
Mhm.
I was a big fan in class, so, and yeah, so when I get to sit and really just kind of get insight from someone else who has been practicing for so long, it just puts a little bit more of a feather in my cap so I can go sit with couples, because couples is not my thing. I definitely don't like doing couples therapy, but you
So-
know.
It's 3 times the work.
It is, and I feel like I'm working even harder than I should be. so.
Wait, get the family in.
Yeah.
Get
Yes.
the family in. What do you mean? Stop griping about couples. Get
Yeah,
the
you're
family
right. You're
in.
absolutely right.
It's definitely
And
good
this is why
information.
she may be a groupie, but I defer to Dr. Sutherland. She knows it. She's got it.
All right, so we're going to wrap up the show. And we've talked a lot. We've covered a lot around depression, a lot around trauma, some around anxiety, and just how that impacts families, what it can look like, so that folks can recognize some of what's around them a little bit better, and know, well, what are the things that I really should be paying attention to? What does this mean? And then kind of know that maybe help is out there that I can leverage that can move us in a different direction, right?
Yes.
And so that's really helpful. If you had to point to just 2 things that you really, really want folks to take away today, if they forget some of it and remember some of it, what are a couple of things that you really just want folks to remember?
Yeah, I would say that there are 2 things.
Yeah.
And it's not any of the informational pieces that we've talked about today or the deeply clinical pieces. It's first and foremost to hear us say and receive the message that all of this stuff comes from somewhere. When we are experiencing the anxiety or the post-traumatic stress or the depression or the conflict in the relationship, it's not craziness. It comes from somewhere. To trust that. And then secondly, to have hope or reach out for hope. That if we find the right resources and the right people to talk to, it will make sense to us and we'll find a way through it from which we'll become stronger and more compassionate and have deeper empathy. There'll be more humility for us and our lives will be fuller. So the happiness will come not because we're aiming for it, but becomes as a secondary gain or byproduct of our pursuit of health and well-being.
Yes.
And so again, we're not crazy. It all comes from somewhere, number 1. And number 2, that there is hope. And we just need to keep looking for those resources that will help us grow.
Yeah, and I think I'll just add one thing to piggyback on that. As we look for resources that will be helpful, look diligently, because everybody can't help. Everybody can't help, and finding the right kind of help will be key. And finding multiple sources, and I say that because I think it's important to note, sometimes if we are in faith relationships in our churches, right, we'll look for help with our pastors, or we'll look for help with our deacons or our lay pastors, and those are fine, supportive help and necessary. That spiritual foundation is critical.
Yes.
But if there are deep-seated traumas, if there are major mental health concerns, you will need to see a counselor in addition to the faith support that you need. It's really important to look for the qualifications of your counselor and combine the support that you have from multiple areas. I've seen a lot of people hurt and not do well because the only help they got was spiritual help. And that's invaluable. It's necessary. But sometimes you have to layer the help
Right.
and get it from multiple places. So
Yes.
that would be the only other thing I would add to that as well.
Yes,
And
that sounds good.
you're coming from a pastoral background as well, so
Yes.
and have additional training as well. So you kind of know the nuances of both those areas of help.
I do, and I very much agree with you that all of that is necessary. And to turn to one isn't neglecting or diminishing the other.
That's right.
It's just adding
It's
to
just
it.
adding.
And we started out at some point talking about how complex and nuanced and wonderful we are as human beings. This is just a recognition of that and a tribute to that,
Yeah.
that we're not one-dimensional.
Yeah.
And that's a good thing.
Yeah, absolutely. Thank you for joining us.
Thank
I
you
hope
for
you'll come back
having me.
another time.
Oh, I would love to. This has
Awesome.
been a lot of fun. Thank you.
Awesome,
Good.
awesome. Thank you for joining us, everyone. We will see you next Tuesday right here on the Dr. Sonja Sutherland Show.
Ooh, yeah.